Dr. Wilson, you're muted.
So sorry about the technical difficulties. That may happen to me a few times today. And so hopefully you were able to thank the rest of the sponsors. I also want to thank the students who helped organize this event. So Yan, Sakira, Ngozi, Salim, one of our staffers, Joe Galarraga, also Rami and Summer. As Yan said, it's really exciting. We have about 664 registrants right now, representing 27 states. And we have folks from around the world, including Bahrain, Belgium, and Mongolia also involved, engaged today. And so I wanted to, before we transition to the first session, I really would be remiss if we have in the US, this uprising against racism, the uprising against injustice in this country, the fight against structural inequality. And today, we're talking about COVID-19. And, you know, we're gonna have a lot of discussions from National Wildlife Federation. We're gonna have sessions on medical distress. We're gonna have sessions on healthcare disparities and testing disparities. We're gonna talk about this syndemic, you know, which multiple pandemics. So we were dealing with a syndemic pre, you know, this COVID-19 pandemic. You know, 400 years of toxic hate and racism, you know, toxic pollution, toxic capitalism, and a toxic climate. And, you know, then there's people over the years who've been fighting for social justice, folks over the years who've been fighting for us, who we've lost this year. As you know, Supreme Court Justice Ginsburg, she passed away after a long battle with cancer. She was one of those fighters. We lost John Lewis, and he was eulogized, you know, some weeks ago. We C. Vivian, we lost Joseph Lowry. There have been a number of fighters and leaders in the movement that, for social justice that we've lost. So I think we should, you know, remember them, take a moment of silence to remember them. Let's take a moment of silence to remember the Black men and Black women, or trans folks who've been murdered. George Floyd, Breonna Taylor, Arbery, many others before them, Michael Brown, you know, Tamir Rice. Let's also honor the 200,000 Americans who lost their lives to this scourge of COVID-19. 200,000 Americans have lost their lives because of malfeasance from the current leadership, because of the anti-science movement in the current leadership. Leadership that knew February 7th how bad this virus was, 5 times more lethal than the flu, that it could pass through aerosols, that it was airborne. And instead of sharing information, providing leadership, that leadership did the opposite, played it down. So the deaths of those Americans are on the hands of that leadership. What we can do today is move forward with action. And through this movement for justice, remember those folks, 200,000 people who died, and let's move forward to address those problems that led to the disparities with COVID-19. So let's just take a quick, you know, moment of silence. Let's do 7 seconds of silence to remember those we lost today and those who we lost due to the virus. So thank you. Now, what I want to do is now transition to our first session. Our first session is a really important session. I had the opportunity to work with the National Wildlife Federation to be a part of the National Roundtable of COVID-19 and environmental justice issues. So in this session, we're going to have dynamic speakers, including Adrian Hollis. We have Rebeca, who's one of the staffers who's worked on the team with Mustafa Ali on this effort. And what we want to do is really set the for the rest of the day. And so I think it's important to note that this roundtable that the National Wildlife Federation organized really include a lot of topics, include a lot of voices from across the country. And, you know, I think it's important to note that National Wildlife Federation and other national partners like the Union Concerned Scientists, like the NAACP, the National Children's Campaign, this is the way we need to move forward to again talk about these issues and to address these issues. So just to give you a little bit of background on our speakers, we have, as I said, Adrian Hollis. Dr. Hollis she's a senior climate justice and health scientist at the Union Concerned Scientists. She's one of those, again, national partners. She does a lot of work at UCS on looking at how health impacts of climate change on communities of color. We also had, as I said already, Mustafa Ali. Mustafa is a thought leader, strategist, and policymaker and activist committed to the fight for environmental justice and economic equity. Mustafa has previously, before working at National Wildlife Federation, worked at the US EPA for 24 years. And Mustafa, in his role as a vice president at National Wildlife Federation, is doing a lot of work on environmental justice and revitalization. Rebeca Villegas is, and Rebeca may have mispronounced the last name, sorry. Rebeca is the manager, environmental justice program manager at the National Wildlife Federation. And so in her role, she builds capacity among the organization to participate and support an environmental and climate justice agenda, the relationship building, project development, and strategic planning. So today we're going to have a series of discussions. They're not necessarily going to be fire chat discussions. We're going to have a series of discussions about these issues. And what I want to do first is open up with this first question to the panelists. And so, first question, we have been talking about the current moment as a syndemic. Many pandemics occurred at once. We're seeing the effects not only of COVID-19, but structural racism, climate change, and extreme political division. How are you feeling right now? I mean, how are you feeling, Mustafa, and where we are, and how are you dealing with this on an individual level? Go ahead, Mustafa.
Well, we're living in a challenging moment right now, but we're also living in a moment for us to show who we really are, what we're actually made of. Is our movement prepared to truly be leaders in these times of crisis? And of course, the answer is yes. So we have an opportunity to actually build real coalitions, these authentic collaborative coalitions that are so incredibly necessary when you're facing these challenges and understanding that you have to be able to address them in a holistic fashion. So, I'm cautious because I also know that sometimes folks are lulled into this sense of their voice doesn't matter, that their vote doesn't matter, and that they don't have power. And when we get into that positioning, then we're going to continue to not only see the impacts, both from systemic racism, but also from climate change continue to grow. But I'm also very optimistic because I'm seeing, whether we're talking about, in the movement for Black lives, or if we're talking about, issues of environmental racism or environmental justice, that Black and Brown and Indigenous and Latinx and Asian and those who've been blessed with wealth and those who are evolving to wealth are coming together to make change happen. So I'm excited about folks seeming to be awoke, if we can say it that way, and at the same time understanding that if they don't get into the fight, then the losses will be generational. So I'm excited because I truly believe that folks are going to come together and continue to grow that and make change happen.
Thank you. Thank you for that great answer, Mustafa. Rebeca? All right.
Yeah. And a similar note, just thinking and reflecting a little bit about all these different endemics that have been happening for quite some time, right? And so, some of the emotions that have come out is just anxiety and worry, right? Thinking about just COVID-19 and how it's unveiled a lot of the disparities that we've known have been happening for such a long time, and thinking about just our lack of preparation, as you mentioned, Dr. Wilson, and angry and sad, just given the circumstances in which we knew this was coming. We knew that COVID was going to be an issue, and yet we didn't have a national plan. We did not move forward on preparing folks. We're not mitigating the issues that we're seeing now. We're not providing the sufficient resources necessary for essential workers to continue to move forward and build this economy and continue to be in this economy. And in a sense too, other kind of emotions that arise is just a sense of relief too. I mean, and I say relief in the sense that people are finally understanding all these different dynamics, all these different pandemics that have been happening for such a long time. So whether that's climate change impacts or just that political division or just structural racism, I feel like the pandemic, COVID-19 has unveiled a lot of those different discrepancies. And so now, as Mustafa has mentioned as well, is, we need to take action. We need to move forward. We can't not unsee all these disparities. We can't turn around. We've all been affected in some shape or form now. And so now is the time to take action, to move forward and to work together to reach these holistic approaches.
Thank you, Rebeca. Adrian, how are you feeling right now?
I feel like 2020 has been cruel in a lot of different ways. As you mentioned, we've lost over 200,000 people, family, friends, colleagues, and over almost 7 million people have been infected by COVID-19 in the United States alone. I feel like right now, the moment that we're in, at this place in time, we have a sort of like a gathering of all roads meeting where we have COVID-19, environmental injustice, climate change, Black Lives Matter, food and economic apartheid, prison reform, sentencing, all of these things are coming together. And for those of us, and the way I feel is that for those of us who are honest enough and tired enough and fed up enough and angry enough, we're going to call it out for what it is. And that's what we've been doing, systemic racism, which is the foundation for everything. And I feel like people aren't going back. We're going forward together, with new partnerships and stronger partnerships. And as Mustafa mentioned, working together I'm hopeful that, and I believe that once we start addressing the systemic racism, we're going to start addressing all of these other individual issues that together make this syndemic that you mentioned earlier, that we're all focused on. And there are those who don't call it what it is, and that is what it is. We have two or more issues that affect certain populations at the same time and cause adverse effects. And not only health effects, economic effects, and issues around infrastructure and things of that nature. So I agree with Rebeca that COVID-19 in the middle of everything else has, I was going to share the wonderful piece from an interview that you and I did around the fact that things that were once sort of like in the dark or unacknowledged have now been acknowledged thanks to COVID-19. I don't know if I want to say thanks to it, but as a result of COVID-19 and the fact that it affects people of color at astounding rates. So, all of those make me frustrated and yet even more laser focused on how we address this syndemic, starting with underlying systemic racism and going forward from there, but not ignoring what has happened historically. And so I guess I'm energized to fight more and even more interested in honing in on specific issues, the specific issues that have gotten us where we are right now.
So thank you. Thank y'all for answering that question. I mean, it sets up well with question 2. So, we have these issues that we know about with the syndemic, and the Federation has been conducting these roundtables. So you hit it on already a little bit, Rebeca, with workers, Mustafa and Adrian with climate change. But what did people tell you about the impacts, what they're seeing across the country, in the Midwest, in the Great Lakes, in the Southeast, in the Deep South, in the West? What did people tell you about the impacts on workers, the climate change and COVID-19? What challenges are folks facing? And let's start with Rebeca.
Thank you, Dr. Wilson. Yeah, absolutely. I mean, there's a plethora of different different topics that kind of arose through our conversation. So whether that's climate change and air pollution, water security, land use and natural spaces, civic engagement, education, food apartheid, infrastructure, housing, and gun violence were all main kind of topics that arose throughout these different roundtables. And the ones that I really want to focus on today is infrastructure, education, and housing. And so, throughout these different communities, infrastructure in terms of water, in terms of water infrastructure, and that lack of ability to access clean and affordable water has become a big issue, and has been an issue for such a long time now, and how that's affected the ability for individuals to be in a healthy environment, to be able to avoid these COVID-related issues is one of the biggest issues. And also thinking about broadband. Broadband was access to internet was a big issue that also arose, and things that we haven't really noticed the impacts until today, when thinking about individuals not only are able to not work from home, but thinking about our students and the education system, and the inability of people and students to be able to continue their education and move forward was a big issue that came about, especially when we're thinking about rural communities, and the lack of infrastructure and broadband that are located in these areas was a big issue, and how that might, contribute to the achievement gap as things move forward. And so there's a lot of concerns surrounding just our crumbling infrastructure, and concerns of how we want to move forward in terms of investments to making sure that people have access to clean water, and also all these other necessities that have been kind of arising as we're moving to this, this 21st century necessities and basic needs. And broadband really is a big issue that we need to be focusing on, and making sure people have access to, and that people are connected. And education, people were fearful in terms of their students, fearful of many folks that were also on the roundtables were representatives from historically Black colleges and universities and other minority serving institutions. And so, not only, issues and concerns surrounding people with social distancing, and just the lack of overall direction and preparation in terms of when COVID-19 comes to these communities and these, education systems. I mean, we're seeing it today, where these universities are continued kind of business as usual, and we're seeing the rise of infections. And the biggest issue that's going to be coming about is, when people are sent home, and how that might spread, and how that might affect communities as well, is a really big issue that, we haven't had a really big kind of national plan or something to try to mitigate that. And, another big issue, as mentioned, is housing, and the lack not only of affordable housing. I mean, we've been knowing for decades now that it's been very difficult to even maintain a certain level of housing among communities. But now, with economics fluctuating, people maybe losing their business or not working as much, or have to not work because they need to be taking care of their children or whatnot. Housing security has become a very big issue. And how can you be socially distant, or make sure that you're taking care of your health if you don't have a roof over your head? So that's a big issue. And thinking about energy and utilities as well, and just the lack of inability for people, and the fear that people don't have these kind of basic necessities to be able to withstand these pandemics is really alarming.
Thank you. Let's build on that. Adrian, what were the challenges that you heard? You shared some already, but what did you want to share some more on that? And what did you hear in those roundtables?
Well, actually, from the roundtables, as a result of them, one of the messages was partnerships. And so in talking to people who participated in the roundtables, one of the issues from communities in the South, where I'm from, was the fact that COVID-19 presented an added challenge when you're dealing with climate change. For example, Hurricane Laura and Hurricane Sarah. As you know, with what happened in Louisiana around Hurricane Laura and the biolab fire, and people who did not have the ability to evacuate out of Louisiana, or who evacuated into shelters, right? That may not have been ready for the large number of people in the middle of a fire, where you're not supposed to open doors and windows or use air conditioning. So you're in a smaller place with people who may or may not have the infection. So your chances for infection now have increased. And that's a big issue. Just the fact that people, that there are those in the health or science community, or even when we talk about emergency evacuations, who aren't thinking of the entire picture, the ramifications of the connections between exposures, someone who's already has pre-existing conditions, and now you put them in a position where they've got to think about how to deal with extreme weather in the time of a pandemic, which makes, of course, all of this, we're back to the syndemic. But the fact that even if you do evacuate, you're going someplace where you may or may not be exposed to COVID-19. You're in hotel rooms, or you're traveling with people that you have not been with throughout this this summer, when we've been practicing social distancing and PPE, protective equipment, and things like that. So in order to save yourself, you put yourself at risk for more health effects. And I think that that's something that was sort of like brought to the forefront a lot with the communities. I know Juan Pérez talked about it in the Manchester community, about the lack of information around COVID-19, and Hilton Kelly talked about it in Port Arthur. And I know that it was an issue in the South, in Mobile, where I'm from, and that, around Africa Town, and my community of Tomanville, which is near Africa Town. So that's a big challenge, just connecting the dots, and then providing, as Rebeca said, that sort of educational aspect, because I know one of the things that Juan mentioned was the need for, cultural competency, right? Information in Spanish and English. So just getting the information out in ways that everybody can understand, in terms of just language barriers initially. So those are some of the things that have really, been brought home to me, and that I have been sort of like focusing on.
Okay, thank you. Mustafa, go ahead.
Well, we should understand that in the 6 roundtables that we did around the country, focusing on various regions, that, as we've been saying, there were these reoccurring themes, but one that sort of weaved through all of them was mental health, and understanding that in this COVID-19 moment, and before, in this syndemic that others have been talking about, there has been this incredible amount of pressure that has been placed on Black and brown communities, Indigenous communities, lower wealth white communities, that others don't have to deal with. We know that we've got, I think it's about 40 million people every year who deal with mental health issues on a very serious way, that we should be paying attention to, and making sure that the resources that are necessary and the capacity is there to be able to address this. But inside of our communities, because sometimes of cultural belief systems, we have shied away from, because we thought, well, we just have to be so strong, or because we've had to deal with so much, we're just like, well, I'll just marshal through it. So now in this COVID-19 moment, you're watching generations of family members dying, right? You might have grandma die, and then you might have mom die, and then you might have auntie or uncle die, and others, along with the pressures, of course, that people have raised about having to deal with, the pollution that has happened in their communities, both on the air side and the water side, and watching people get these chronic medical conditions that, of course, make people more vulnerable to COVID-19. So the mental health aspect was a part of the set of conversations, but also the air impacts that are going on. So let's just call out for the audience the reality of what's happening in our communities, and then you can easily tie it back to the mental health aspect. We've got 100,000 people who are dying prematurely every year in our country. That's more that are dying from air pollution than are dying from gun violence. That's more that are dying from car crashes. So if you got that much going on, and you're watching a government that is rolling back basic air protections, then that tells you that your life probably doesn't have a lot of meaning. So you've got that additional aspect of the mental health pressures of knowing that somebody is using your tax dollars to actually poison you and to shorten your life. That's some deep stuff to have to deal with, on top of all these other things. So we also had folks who were talking about gun violence. We got over 36,000 people who are dying each year from gun violence. So again, you have that piling on. That we often talk about a toxic loading. There is a mental loading also that's happening. And I know Dr. Wilson will come up with a catchy phrase for the mental health loading that's going on in our country. But that is a part of the sets of conversations. We also had some really deep conversations about not only water pollution and the impacts that are happening there, but also water affordability and access. And Miss Monica Patrick Lewis from We the People in Detroit broke it down for folks, both in those regional roundtables and in the town hall, talking about, you know, how people's waters continually get shut off, even in water that folks don't trust, and then how that messes with your credit score, right? And makes it so that it's even more difficult for you to navigate this system when we already have this huge wealth gap in our country, and that there are folks who are losing their children whenever their water is being turned off. That's some deep stuff. So let's once again take it back to the mental health impact of not being able to afford the water, of losing your child, and then having to deal with all that pressure of those types of situations that are going on. That's real stuff. In our country, we got 2 million people who don't even have access to water or sewage, right? They don't even have it hooked up. So that's crazy in the most, in a country that's supposed to be the greatest and all these other, you know, labels that they put on it. Well, you can't be that damn great if you got 2 million folks who can't even be hooked up to water or to sewage, because we understand the public health impacts that happen from there. Then we talked about also food insecurity, food deserts. We got 24 million folks in our country, you know, who are dealing with that type of a situation. So folks talked about not only the problem of it, but also the solutions of making sure that land goes back into the hands of folks who want to actually be able to farm the land. And we had a little bit of conversation about Black farmers and the loss of land in that space, but we know that there are other brothers and sisters of color who have also lost land. And then we also talked about, we got 80 million people in our country who are underinsured and uninsured, and how these environmental impacts, these COVID-19 impacts play out when you don't have the right types of healthcare coverage. Because yeah, you might be able to get the test for free, but all that follow-up that's necessary can literally put you, you know, in bankruptcy, if you will, from all the various costs that could be associated with that. So those are just a few of the additional things that we talked about. And then just a quick shout out, and hopefully we'll talk a little bit about it, is also that there was a youth-led, youth-designed aspect to our work, which far too often we don't see many organizations understanding the power and actually honoring that in a real way.
Yeah, no, thank you. Very, very powerful words from our panelists. Just want to highlight, you know, you're talking about we're in this endemic. We had a question about why we have these COVID-19 disparities. Y'all talked about it. Food access, you know, just unjust. We talk about just sustainability, unjust access to food, unjust access to healthcare, right? Unjust access to water. Mustafa mentioned 2 million people. You got what, 20% of our country lives in rural areas. More than likely, they're still on septic tanks and well water. Some people choose that, but a lot of folks are folks of color. They don't have what we call Omega Wilson calls, it's a lack of basic amenities. So you're talking about the fact that you should have a human right to water. We have a human right to food, a human right to energy. So we're talking about, we're not talking just about environmental racism, right? We're talking about human rights abuses in this country. We're talking about state-sanctioned poisoning, as Mustafa mentioned, and state-sanctioned violence. I call it a virological violence. Maybe it's too much to say, y'all, but that's what's going on with COVID-19. It's state-sanctioned virological violence, right? And so what I want to get at, and we're going to get to the question about youth, Mustafa, but the next question, because I want to make sure I get a good number of these questions in and get to the audience. I want to go back to the workers. I think it's really important to highlight what's happening with workers, essential workers. And I'll just say real quickly, I have family members. I had a niece who had COVID-19. She was working in a restaurant. I have 3 siblings who are healthcare workers. One of my siblings have autoimmune condition, Marnique. She had COVID-19. I had a brother who's a nurse. 3 siblings are nurses. He quit his hospital job because they weren't giving enough PPE, right? So let's talk about these workers, right? I mean, people who are working around the clock who don't have access to food, healthcare, and medicine, you know, they want to work right now. People want jobs, but can't get out there to work. And they can't afford to go out to work because they may bring COVID-19 in some cases back home. So what are the implications of this COVID-19 on the workforce? And I'm going to start with Mustafa, but also not just the implications related to the workforce. COVID-19 during our plantation capitalism, as Reverend Lawson said when he eulogized John Lewis, this plantation toxic capitalism. Can you speak to that, Mustafa, first?
Most definitely. So when you look at frontline workers look like us, right? They are African-American, they're Latinx folks. In some instances, they're Indigenous and Asian. And then, of course, also lower wealth white brothers and sisters as well. We don't want to exclude them from this conversation because they're on the front lines also. And we're building an inclusive movement to address these issues. Let's understand this. When you have an administration that says that a virus, and we're talking about COVID-19, is a hoax, that has ripple effects through your economy, and it has ripple effects also through the prioritization of the steps that are necessary. I worked a whole bunch of man-made and natural disasters when I was in the government. And what comes from the top is important. So when you have the dynamic that we're currently in, that's the reason you had a lot of people dying early on, not just because they refused to move forward, but also in the protective equipment and thinking critically about, one, making sure that you have enough of it, and then where does it go? So of course we had to have it for our medical personnel. But look at the huge amount of folks who died in meatpacking and some of these other industries that many Latinx brothers and sisters and folks from the Caribbean were losing their lives working in these facilities. And much of it was because of, the top in our government was saying this is not a priority. So the ownership of these businesses, those owners were taking that message and weren't doing what they needed to do early on in the movement, which then meant that folks weren't having the right types of protective equipment. There wasn't the social distancing that needed to be built into the factories, for quite some time. So that's how that stuff plays out. When you got folks still working in the fields and don't have the right types of protective equipment, that once again says that you don't value their lives. And I take that all the way back up to the top when they try and minimize it because they're trying to rush the economy forward without putting the right protections in place. Then you're putting Black and brown lives at risk intentionally. It's not by accident. Folks had the information. They're the ones who made these choices. When you have folks who are bus drivers and working our subway systems and all these other jobs and not making sure that the right types of protections are in place, then you're saying that their lives don't have the same level of value. And we see that throughout our economic system. And I know Dr. Hollis and Rebeca have some additional things they want to add, so I'm not going to take up too much time there.
Thank you, Mustafa. Go ahead, Rebeca.
Yeah, just building off that, I mean, I think, just given the lack of also preparation and resources, it's also this misconception of having essential workers as heroes, right? As folks that are being sacrificed, basically. And that is an issue. That's a big issue, just given that we're not providing folks with the essential necessary resources that are required for folks to actually do the jobs that they need. And so, and in addition, just making sure that we also have some types of worker protections for people. I mean, my father is an essential worker as well. And in terms of, and he works in a packaging industry, and rather than, as the COVID was kind of evolving and moving forward, he's tried to take some time off and they wouldn't let him. The repercussion for basically taking some time off is working more. And so in addition to working from 7 a.m. to 7 p.m., he worked for longer periods of time. And we're talking about a 75-year-old man with underlying health conditions. And it just goes to show just this lack of just overall humanity in terms of trying to keep our economy moving forward and capitalism. I mean, it's a contradiction in and of itself. We are sacrificing resources, we are sacrificing people to keep this economy, and we shouldn't, again, make these individuals that are doing these jobs and having to do this work, right? It's not necessarily because they want to do these types of jobs. It's because they have to support their family. And so rather than making them as heroes and putting great memes up and kind of moving that forward, we need to protect them. We need to protect them with labor laws as well, and making sure that they have the resources. And in addition, as Mustafa had mentioned too, in terms of farm workers, I mean, there's individuals right now as we speak, even with the fires and smoke happening out in the fields, doing the work. And what do they have afterwards? They have to go into these types of housing systems that are, you can't be socially distant, basically. You're forced to live in a small shelter or trailer with 2 or 3 other families and other individuals. I talked to one of the migrant farm workers that unfortunately wasn't able to go to the roundtable, but did provide me with a lot of intel in terms of his circumstances and the people that are facing. And again, there's also issues supporting regarding just repercussions that people have. So not only could you potentially lose your job, but if you're not documented, you can have ICE get called on you, basically. So there's all these, pressures, these extra pressures that these individuals are facing. And again, rather than making them heroes, we need to provide them with the resources and the protections necessary for them to continue doing the jobs that are benefiting all of us. Thank you.
Thank you. Adrian, can you respond to that question, please?
Yes, I'll do. I wanted to share that 2 of my brothers are frontline workers, one in Alabama and one here in Maryland. And the one in Alabama was laid off at the beginning of the COVID-19 pandemic, and they were just laid off, and which meant that we had to support him, which isn't sustainable for the family, right? But you have to do this because that's your family. And he was, one of my concerns with him as a frontline worker, when he did go back to work, they, in Alabama, in Mobile, they still had people coming in, customers coming in, not wearing protective gear because they weren't enforcing those regulations. And he would be upset, but he couldn't quit his job because he needed the job, as Rebeca said, in order to work. Another issue that people don't think about is, I think Rebeca kind of alluded to it, is when you go home, you could be exposing your family. Well, my mom is immunocompromised, 4-time cancer survivor. My brother could not go over to her house unless they were both fully wearing their PPE because, she was more at risk for COVID. And we don't think about those sorts of impacts. My brother here worked throughout, thank God, the summer, but when it came to wearing protective gear, he wasn't necessarily initially provided what he needed. Right. And I had to think about when you provide masks and things like that to Black men, what does that look like? You can't get Black or brown. You can't cover up most of the face. You have to think about things that are going to protect their lives, because in the middle of the pandemic, Black lives still matter. And there's still issues with police brutality and, that racist behavior. So I can't have my brother walking down the street in a Black mask or running to catch the bus when he can, because Black man running is nothing but a target. So, I had to think about providing a light, think about things like what color mask to wear. Should I get, tan or pink or whatever, things of that nature. And in addition, when we talk about workers and our workers, we need to also include in that, and I'm sure we are, our healthcare workers, as you mentioned, your family members. I cannot fathom the fact that we did not have protective gear available before the pandemic for situations like this, for those who are going to be working to save the lives of most of the people, so that the number of 200,000 wasn't, 2 million, 5 million, right? Even though 200,000 is utterly extreme and unacceptable to me. I think that we need to, when it comes to frontline workers, everybody was concerned about how they were going to, I go to the store, I'm scared to go to the store, I need to do Instacart or whatever, but we weren't thinking about who was providing that food, out in the fields, who were exposed to that, and so I think that when we talk about what we're going to do going forward, as you mentioned before in our interview, one of the first things we need to think about is protecting those on the front lines. And the front lines doesn't necessarily mean just our essential workers out in the grocery stores and helping us, the pharmacists, the pharmacy techs, it includes the physicians, the nurses, and all of that. And we need to already be prepared. Right now, we should already have an overabundance of PPE equipment at this very moment, because the pandemic the pandemic, being COVID-19, is not over. As far as I know, we haven't even finished the first wave. But I look around and there are people who seem to think that it never happened, and it did. And so we should be protecting our workers. My brother should have masks he should have a mask for each day of the month for the rest of the year. And that should be the same for any frontline worker. So And just in addition to all the great things that were already said.
So Kobe,
go ahead.
just add one thing, because sometimes we allow this to be theoretical conversations, even though we're anchoring it, and we don't put the responsibility where it belongs. This administration is responsible for these 200,000 lives that have been lost, and the more, the additional ones that are going to happen. They had an opportunity when they came into office. There was a program that was in place to deal with pandemics, and they decided to get rid of it. They get a briefing when they come in. They decided not to pay attention to it. They knew what was in the warehouses across the country, and they decided not to make the investments that were necessary. There were conversations with them to prepare them to say that here's what has happened with these previous pandemics, these previous viruses that we've been dealing with. Take it serious, and they decided not to. So whether it is on the federal level with the White House or these governors who have decided not to do the right things, they are culpable in the lives that have been lost.
And I've got to add to that. I'm sorry, but
go ahead, Adrian.
That is such a powerful and important point, Mustafa, that we have to say. When the EPA decided to get rid of oversight for facilities in communities that are already exposed, right, to toxic chemicals, and that made them more susceptible to COVID-19. They made that decision knowing that who was going to be affected first and worst, the communities of color who live near these facilities, right? Or when they decided to open up the economy early, not because people needed money, although they did, because that could have been addressed through a better stimulus package. They decided to open it up for their own convenience, but who was going to be affected first and most? People of color. So you're absolutely right. The decisions that were made were not made with people in mind and public health in mind. It was made with the premise of increasing the profits in the pockets of those who were not going to be at risk from exposure. And I just wanted to underline that because that is so very true.
No, thank you. I think those points are well taken. We're running low on time, but I want to say something real quick in response to what you're saying. You have an administration that shows that it doesn't value certain people. You have an administration who, again, as I said, anti-science. You've had an administration that didn't listen to the experts. You've had an administration who's politicized the CDC, the sort of the beacon on the hill as it relates to science, public health in the world. The MMWR reports, mortality reports, weekly mortality reports, the administration who's lied, they've actually lied about, the mortality rates, the risk factors. You even just seen recently the changing of the CDC guidelines. If you're asymptomatic, hey, you don't have to get tested. We all know in public health, we all have common sense. Common sense has not been used, as you said, and people have died, and those deaths are on the hands of this administration. But we have to fight back. So we need to fight back. And as Mustafa said, this is an inclusive movement. We all need to come together. Now we're running a little bit behind time. What I want to do is take one last question for you and combine it. And then maybe take some quick, this is going to be a lightning response, everybody, because it's a great session. We'll have to get to the next session, which is going to build off of some of these issues around COVID-19 as it relates to what's happening in Prince George's County. But what are some solutions? Mustafa, you mentioned the youth engagement. What are some solutions that came out of the roundtable discussions that you want to share with the audience? And I'm going to go to, maybe I go to Rebeca first, and then Adrian, and then Mustafa.
Yeah, great question. I mean, in terms of solutions, again, I just want to highlight, our summary of findings that contain a lot of not only the issues that arose, but also different recommendations associated with addressing those issues. So please make sure to check out the chat box with that information. And so, in terms of some solutions moving forward, I think the biggest component, you mentioned youth, right? And making sure that folks are empowered, that the youth, the future of our nation, is empowered to tackle a lot of these issues. And I think one of the biggest kind of things that arose, at least through the youth-centered roundtable, is thinking about just the systems that are at play and the contradictions inherently within systems, right? Thinking about capitalism, thinking about even just land use and land policies associated with that, And so, you know, in terms of some solutions, it's really just rethinking the way that we do business, but also the narrative that we, you know, showcase or highlight, whether that's in the education system or not. You know, we are continuously, you know, we're continuously educated regarding, you know, white dominant culture. And, you know, we don't think about all the different issues that have arisen, you know, throughout various decades. And, you know, we need to correct a lot of those different issues and making sure that people are learning about all these different dynamics, all these different issues, the way that our communities, Black, Brown, Indigenous communities have played a factor in really moving forward a lot of these issues. And again, in terms of the environment, we're talking about partnerships, bringing people together. We need to connect those dots for individuals, you know, in terms of environment. You know, we need to broaden our sense of what the environment is in general. It's not just about camping, hiking, and all these different components, but we need to think about the intersectional issues that are rising and how everything is interconnected in order to really create a holistic solution to continue to move forward. So I'll stop there to let folks also build upon that.
Go ahead, Adrian. Thank you.
Yeah, short and sweet. We need to vote, and we need to vote for policies and people that are going to protect us and our health. It's very clear. You know, it's very simple. Just, you know, you're going to vote for things that are going to be protective of you, as opposed to things that are ridiculously beneficial to those who don't really give a damn about your health and welfare.
Thank you. Mustafa?
Change your mindset. Understand that you have power. So many folks continue to forget that they actually have it. I know we can't hear everybody right now, but no matter where you are across the country or in other countries right now, you need to just call out loud, I have power. Because when you know that you got power, it changes the dynamics. It means that in the United States, you still got a couple of weeks left to fill out the census. So if you're not filling out that census, you are literally taking dollars out of your community, and you're also lessening the opportunity for your representation. So if you truly believe that you have power, get the census filled out and make sure that somebody else who hasn't done it yet, who's a part of your family or friends, does it. As Adrian said, also, if you know you have power, then make sure that you're registered to vote. If you can early vote, vote. If you have to stand in a line to vote, make sure that you're protected and vote, and then make sure that you got some other folks who are part of your family or friend or circle who are voting, because then that translates into making sure that we have the right housing in place. That makes sure that we are honoring those folks who want to be entrepreneurs and that they look like and come from our communities. That makes sure that we're dealing with the air and water pollution. And that also makes sure that we're dealing with these medically underserved areas, these physician deserts, when people are impacted and infected, whether it's from pollution or from COVID-19, and they can't get to that, you know, to the need that they have to have a conversation or a set of actions from someone in the medical field, that you got that covered. So know you have power and then utilize it.
Thank you. Thank you, everybody. You got to vote like your life depends on it. And it does, right? It does. So let's take, so Yen, we have about a few minutes for a couple quick questions. So Yen, go ahead and ask the first question, or have one of the attendees ask their questions, whichever way you want to do it. Go ahead, Yen.
Sure. So we have a question from Larry Davis that says, how can local eco-entrepreneurs best pivot to address environmental disparities to historically disenfranchised communities? And he gives an example, urban farmers and food insecurity.
Who in the panel wants to take that question?
And I think this pivot is with regard to in the time of COVID-19.
Well, I'm not sure the best way to answer that. I mean, I know the importance of it if we're going to deal with, you know, all these challenges that we have to our health, and as we're thinking about how do we increase, you know, you know, being protected and strengthening our bodies, if you will. And of course, you know, we just got to make sure that more folks are being able to start their own businesses in this space, whether they're co-ops or other models that folks are using, and making sure that Black and brown people are getting back to their historical roots, if you will, of being connected to the land. And then also making sure that, you know, fresh and affordable produce, it doesn't have to come from across the planet, or it doesn't even have to come from across the country. It should be coming from locally sourced sets of opportunities, along with all the other jobs that are associated with that. So we can create these regenerative economies you know, that are healthy and that are connected to the needs that exist inside of our communities.
Anyone else want to jump in?
I just want to add to that, I don't know about if this addresses local eco-entrepreneurs, but he made me think about the fact that, you know, a number of farmers, and they weren't people of color for the most part, they weren't large farms, they weren't small farms. They were destroying the milk. You see them pouring milk on the ground. You see them throwing away food because then they could write it off for their income taxes. And instead, we need to pivot and think about how can this help. You know, you saw people lined up. We saw it all on the news, people in lines trying to get food because they didn't have access to food, healthy food for sure, Mustafa, but eat something to eat in general because people were laid off and they didn't have money. So why are you pouring the milk out into the soil? Why are you throwing away perfectly good crops? Because it's not going to benefit your pocket, but it's going to benefit the planet, the people on the planet, those of us who don't have access to food. And so I think that when we pivot, think about how can what I have benefit those who have less? Right? That's the question that we should be asking ourselves. And that's the same question that when Mr. Davis talked about with local entrepreneurs, think about the reason, hopefully the reason you started your business was because you wanted to help people. And then think about ways to do that.
I just want to quickly add too as well, you know, folks have already mentioned important points, but also getting involved in local government and thinking about the policies that are in place, not even, you know, within the community, but also on a state level, and especially when we're thinking about food and land use, for example. You know, not all communities are able to, you know, retake vacant lots, for example, to repurpose them for you know, to provide community gardens for individuals. It really just depends on certain policies. So making sure that you're kind of, again, reinvesting within local areas, but also thinking about the policies in play that could potentially help advance that different priorities that kind of come about, especially as it pertains to food.
No, thank you. I want to say real quickly, and I've been getting texts from folks. Y'all can't see me, so I'm trying to fix it. so try to put a little light on the head and let it shine a little more. But no, I think the whole food sovereignty piece is really, really important. We have to, as part of this addressing these issues around COVID-19, and remember, it's exacerbated things. Food insecurity is already there. Energy insecurity was already there. By food forest, food sovereignty, we can impact the food energy water nexus. So I think that's something we need to do. As Mustafa talked about it, invest in urban agriculture, changing zoning, and really building cities that are just, right? So Rebeca said that we have to get engaged in that process. So I think this answer, as you said, the compounding effects of things, the onion, right? You know, the multiple things. This solution will also positively impact all those other things that we've been talking about, y'all. So I want to thank the panelists for opening us up today with this great discussion. Hopefully, Rebeca, you were able to share the information through the chat about the report. Please really check in and see what National Wildlife Federation is doing on these issues, y'all. They are taking the whole JADA approach seriously. You know, Adrienne is leading UCS forward in her own way with trying to take JADA seriously as well, right, Adrienne? And so I really want to show appreciation to our panelists. And then we're going to go ahead and do a quick transition. What do you think, Ian? 2-minute transition to the next panel?
Yep, we can take a two-minute break.
Thank you, everybody. Thanks, Mustafa. Thank you, Adrienne. Thanks, Rebeca. Appreciate you.